Welcome to my second individual palpation videos for structural kinesiology. So let's go ahead and get started with the shoulder girdle bony landmark. So first we're going to start off with the clavicle. So you can find your clavicle because it's this little gap right here. It separates your two clavicles. So you're going to find that, and then on either side are your clavicles. And then there's a sternal end, which is by the sternum, which is right down here. So the sternal end is this portion of your clavicle right there, and then the acromial end is by your acromion process, which is on the humerus. So if you travel up the clavicle, then you can find the acromial end. Now there are two joints, the sternoclavicular joint, which is again on that sternal end, and it is articulated with the sternum, and then the acromioclavicular joint, which is articulated with the acromion process, which is right at this joint up here. So next we're going to move on to the shoulder joint bony landmarks. So we have your humerus, which is this bone right here. It's a very nice bone. So we have the head of the humerus up here, and the deltoid tuberosity. The deltoid tuberosity is halfway between the shoulder and the elbow. So if you kind of travel, there should be a small mound on the lateral side of your arm. So you can kind of try and palpate until you find it. And I think it's right there. Yeah, so yeah, it's just like a small mound. And then next we have the greater tubercle, intertubercular groove, and lesser tubercle of the humerus. So what you can do to find it is have your individual like hold their arm like this, and then you can find, if you go down inferiorly and laterally 1 inch, you can kind of feel a bone here, and then if you have them externally rotate, you can feel it moving, and then there's like a small divot right here, which is the groove, and then just past it is the lesser tubercle. So the initial starting point was the greater tubercle. So that's how you find those three. So the next thing we're finding is the neck of the humerus, which is just right below the head of the humerus. Yeah, so that's that. And then we have your manubrium, which, oh shoot.
Oh, you got it.
So we have, going back to the shoulder girdle bony landmarks, we're gonna go to the manubrium, which is on the sternum, the upper part of the sternum, which is right here. It's very solid because it's a bone. And then we have the scapula. So you have your individual turnaround. All right, so the scapula, okay, there we go. The scapula, so it's just this region here, and if you look for the inferior angle, it kind of makes like this L-shaped angle like this, so you can kind of feel for it that way, and then you can find your medial border in the inside of the body, and then the lateral border. So that's kind of how you find your regions of the scapula. So yeah, just finding that inferior angle and then traveling up. And then we can also find the spine of the scapula, which is this really bony region, kind of right below this, like just where your skin is, like just going down, and then you find like a bonier process here, which is the spine. So after that, going back to the shoulder joint musculature. So for this one, we're gonna start with the deltoids. So your deltoids are kind of just right where the shoulder like curves down, like where your like body turns into your arm, one of your upper extremities. So the deltoid is right here, and the anterior is facing this way, and then you have the medial aspect, and then the lateral. So those are the three parts of the deltoid. And then you have your pectoralis major, which articulates between the humerus and sternum. So it's like between here, and it's kind of just this huge region of muscles. And there is a pectoralis upper fibers and lower fibers. So that's kind of where those are. And then we have the latissimus dorsi. So it's kind of just like your whole back region. It's a huge muscle. But it covers it inserts on the humerus, and so when you extend the shoulder, like back, yes, you can feel it contracting if you palpate between the humerus and the spine. So it's like from here to there, and it's just this huge muscle, and you can feel it when you have your patient extend. Next we have the teres major. So that is on the inferior portion of the scapula. So you're gonna find again that inferior ankle down here, and then if you go superior on the bone, and you can feel that inferior part, then the teres major should rest right here, and it also inserts onto the humerus. So it's just this whole area right there. Okay, perfect. And then moving on, we're gonna go to the coracobrachialis. So yeah, thank you. So for this one, you're gonna find the coracoid process, which is, if you find the scapula, oh my goodness, the clavicle, and you go inferior, you can feel the coracoid. Right. That was it right there. Okay, gotcha. So right there, it's a little bit tender, so yeah, be careful when you're palpating. And so it goes from there to your deltoid and medial bicep, so like in there, so on the inside. So it's kind of just going down like that. Yes, perfect. Okay, now we're gonna go on to the shoulder girdle musculature. So for this first one, we're gonna start off with the serratus anterior, which is just located like right here. And so if you have your, have someone lift their arm, you can palpate alongside between where the pec major and latissimus dorsi is, and the serratus anterior is just right in there, and it has like fibers going horizontally. So that's where that is. Okay, then we have the pectoralis minor. So this is deep to the pectoralis major, so it can be a little hard to palpate, but again, you find your pectoralis major, which is between the sternum and the humerus, and so it's kind of this region, but you can find it if you have your person depress their scapula. So like it might be hard to find still because it's deep to the pectoralis major, but it's if you have them like lift up and depress scapula, you might be able to feel it contract. Okay, the next muscle we're doing is the subclavius. So this one is deep to the clavicle. So if you just find that your clavicle again, and you palpate deep to it, then you might be able to find your subclavius, but again, this one is also really hard to palpate because it's hard to distinguish between other things. Yeah. So then we have the trapezius, another kind of big muscle. There's also 3 parts to it. There is the upper part. So if you find someone's occipital protuberance up here, then you have the upper part of the trapezius going down here like this. The trapezius then like branches off and the fibers start to go horizontally. So then it transitions into the middle part of the trapezius, and then the lower part of the trapezius goes down the spine. So it's like this cool shape, and then the lower trapezius is down there. Yeah, sorry. Okay, then we have the rhomboids. So these muscles are deep to the trapezius, and they articulate between the scapula and the spine. They're deep to the trapezius, but they're superficial to the erector spinae muscles. And so you can find the medial border of your scapula, medial, and then transition to the spine, and they should be deep to your trapezius. And then the rhomboid major is inferior to your rhomboid minor. Yeah. And the rhomboid minor is, it travels upward and diagonally, kind of like that. Whereas the major is more kind of like that. Yeah. Okay, and then for the last muscle, we have the levator scapula, which is a muscle that goes from like your cervical vertebrae, and it goes down to and articulates on your scapula. So what you're gonna do is you can find that extra prominent C3 vertebrae. Everyone's is kind of a little bit more, what's it called? Prominent. That vertebrae is more prominent, it's easier to palpate. And then, so you can find the upper cervical vertebrae and then kind of palpate down to the scapula and try and find the levator scap. Although it might be hard to find with the trapezius there as well, but there are, as you go up, ascend the neck, then it's easier to palpate for it. And I think that is all.